Hello, the fashionable midwife is here. How you doing? How was the service today? Hope you are all doing well. I wish you all the best for this new week. So, yesterday I was live, but not many people knew, not many people came. It's been a while that I've not done live, but I started these few days to be going on live. So, if you are one of my subscribers, please come. Let's gist. This is a beautiful topic. This night, I want to talk about abortion, either in pregnancy or in young ladies. It's a very sensitive topic, but we need to talk about it. That's just the truth. We need to talk about it. Abortion, either in pregnancy or in a teenage girls or in an unmarried person, is not something to joke with. A lot of women have lost their life during abortion, especially if they go to quacks. As midwives, as healthcare providers, we can do better by, you know, telling them, educating them on safe sex to reduce this unnecessary deaths among our women. And for a woman that is pregnant, there are precautions. Maybe you've had a certain abortion before. You were placed on complete bed rest. If you follow all the advices given unto you, and if you take your medications very well, the pregnancy will continue and it will get to term. So abortion is not something to joke with. And generally when people hear abortion, they will think it's criminal abortion. No, there are some abortion that can happen spontaneously, which may be a sequel to threatening abortion. That's why as a pregnant woman, from first week to about 20 weeks, if you notice any bleeding, you notice any abdominal cramps, you have to go to the hospital or talk to your midwife to see what can be done. So as a pregnant woman, bleeding, spotting, severe abdominal cramps is not something you have to keep quiet. You have to make sure that you talk to your healthcare provider, talk to your midwife, and she will examine you and tell you what to do. So let's get started. What is abortion? Just like I said, today we are talking about a sensitive but very important topic: abortion. Abortion. The lay people call it miscarriage, especially if the woman is married. Let's understand what it really means, the types, and how we can help people to prevent unplanned pregnancy. Even some married women, they do go for criminal abortion. Maybe they are breastfeeding and they are not on any family planning method, and they discover that they are pregnant. Some of them do come to see us in the hospital that, matron, I miss my period, my baby is still small. What will people say? What will you know they want to remove that pregnancy. So when you hear abortion, it doesn't mean that it's only young girls that does it. Even married people, responsible married people, that because they were not on any family planning method, and when they get pregnant, they want to get the baby out of the way. Either it will prevent them from doing so many things, their businesses, their life will be shattered, because they are still nursing a child, and now they are pregnant again. So there's tendency for them to be so worried, and they want to remove the pregnancy. So just like I told you, abortion is the medical process of ending a pregnancy so that it doesn't result in the birth of a baby. It's a medical process of ending a pregnancy so that it will not result in the birth of a baby. And just like I said before, it can happen spontaneously, which we call miscarriage. It can happen as induced abortion. Before spontaneous abortion, we have what we call threatened abortion. Threatened abortion is when a woman is pregnant and the pregnancy is just from first week to 20 weeks or under 20 weeks. The patient may be spotting, the patient may be bleeding, the client may be bleeding, having abdominal cramps. If she go to the hospital, she'll be examined with, they can do scan for her, they can do gentle vaginal examination to see if the cervix is dilated. If the cervix is not dilated or it's just 2 centimeter dilated, she can be admitted into the hospital and placed on a complete bed rest with medications, sedations, uh, you know, pain relief and some other things so that she will relax, and most time this pregnancy can continue to term. That's threatening abortion. Threatening abortion is mostly common in pregnant women, and e do have some of them we may go on, some may not go on, depend on how bad the bleeding is. The pregnancy may still be viable until when she's examined. What are the signs of threatening abortion? Just like I said, we have vaginal bleeding, it may be light to moderate. We have abdominal cramps and back pain. The cervix is closed most time on VE. Yes, most time is closed, but there will be bleeding. Then it occur mostly in the first 20 weeks of gestation, just like I said before. They will do a gentle VE for you. Okay, so what are the causes of this threatening abortion? We have hormonal imbalance, we have infections, we have physical trauma. She maybe she fell down, or maybe domestic violence, stress or overexertion. We have uterine abnormalities, maybe fibroids, it may be some other cases. So what advice will you give to a woman that has threatened abortion and is now in your hospital? Just like I said, we place her on complete bed rest to avoid any strenuous activities. In fact, if you are discharging her, you have to counsel her that don't do anything strenuous, don't lift anything heavy. She should avoid sexual intercourse for now temporarily until she's okay, because we know sexual intercourse is a rigorous activity and some men can be very rough. So we have to tell her that for now, counsel her and her husband, no sexual intercourse for now. And we should also encourage her to continue to take her prenatal vitamins as prescribed for her. And the pregnancy should be monitored by ultrasound till the baby's heartbeat is well established and the baby is in good condition. We should encourage her to come for regular checkups as in an ten atal at with a healthcare provider, preferably a midwife or a doctor, to be checking her to make sure everything is okay with her. And just like I said, many women with abortion will go on to have a normal healthy pregnancy if properly managed. So that's for threatening abortion. Now, induced abortion, we have spontaneous, we have under that spontaneous abortion, we have habitual abortion. Habitual abortion may be from, you know spontaneous too. Maybe she has had 2 or 3 miscarriages, so we say she's going through habitual abortion. And in most cases, that one they will do some laboratory investigation for her to know what is the cause of that habitual abortion. If it's an incompetent cervix, there's what we call cervical encyclage, where a suture can be sutured around the cervix after 16 weeks so that she can be able to carry that pregnancy till term. But we have to tell her to be coming for checkup, and we have to tell her that if she's continue having severe abdominal cramps, she should come back to the hospital so that she'll be well uh, managed. So Induced abortion, just like I said, that is a deliberate termination of a pregnancy. That threaten, if she was well treated and she still aborted, we can still put it under spontaneous, because the whole thing can come out. It's a natural occurrence. There's nothing anyone can do about that. But induced abortion, it means that it was an intentional mind for that person to say, I want to remove this pregnancy, I don't want this pregnancy. Or in case of a pregnant woman, maybe when she's pregnant, she's always falling sick, she's, in fact, her health is terrible. Doctor can advise that let's terminate this pregnancy so that this woman will be okay. There are some cases of hyperemesis gravidarum, severe cases, that most cases the doctor will advise that this pregnancy should be taken out for the woman to be okay, which is very understandable. It's only when you are okay that you can carry pregnancy without problem. Pregnancy itself is stressful, so the patient have to be in very good condition. And in the induced abortion, some can use pills to end early pregnancy. Under this induced abortion, we also have surgical abortion, a procedure that is done in the clinic to remove pregnancy, especially unplanned pregnancy, or it can be dilatation and curettage. Maybe they want to, after a patient has gone through threatening abortion, there's what we call incomplete abortion. We have complete and incomplete spontaneous abortion. Under that complete, everything will come out. No need, the placenta, everything, and everything will come out. There won't be any retained product. Then in incomplete abortion, the client may still have some retained product, part of the placenta, membranes, and they have to do evacuation for her. If not, she'll be bleeding, and that could be fatal. So after doing evacuation, then she'll be given medication before she will be discharged home. So, in this abortion now, especially for the um teenage girls that just get pregnant, we should, yes, we are all religious in Africa, but the truth must be told, because even as they go to church, even as they go to mosque, they are still having sex. Some girls, even at 14, 12, they are already sexually active, and you are having sex without any protection. You should expect pregnancy. There's nothing you can do about that. You have to just tell them the truth. So in preventing unplanned pregnancy, education and awareness is very important. We have to teach them about reproductive health, fertility, and safe sex practice. We have to tell her she's already sexually active, she has to be on family planning. That's the truth. Don't say, she's a young girl. If you don't give her, she will go elsewhere. She can be taking injection. Even you as a mother, you will not know. But in this side of the world, when you say, they will say, God forbid. What sort of girls? There's so many girls. Even when I was doing my midwifery, then I had a classmate that she was already, that time I didn't even know Kopati. She was on family planning. As at that time, the I got to School of Midwifery in 1987, and I graduated in 1990. You can imagine, as at that time. So don't say, I trust my child. If you just notice that she's wayward, or they bring that kind of a person to you in the hospital, please counsel her on safe sex. And if there's need, she has to be on the use of contraceptives. The husband or the boyfriend can use condom. There is injectable, there is IUDs, and there's emergency contraceptive tablet that she can use that will make her to be well protected. Because aside this one, aside this that she can even go and use medication to go through criminal abortion. What about infection? She could get STDs. She can get PID. She can get HIV/AIDS through unprotected sex. So we need to tell them about safe sex to make sure that no any problem will come to them. It's very important. So I think that's just it for this abortion. we should make sure that we do enough counseling, health education to our girls. Even when our clients come to the antenatal clinic and she has had a threatening abortion before, we need to tell her the importance of doing away with stress, complete bed rest, and she should get help. She should get someone that will be assisting her at home to do so many things. Abortion is real, either the person is married or single. A lot of women are still doing abortion up to today, and that can be prevented by being on contraception, by counseling them, telling them about safe sex, telling them about their fertility, that if you continue aborting, when you are ready to have kids, you may not have kids. Your womb can be damaged. When I was working in Kebbi State, I knew of a girl that had criminal abortion, and they perforated her uterus up to her intestine. She had to be opened up, you know, but she later died of infection. So all these things are not things that you have to joke with. You have to take your life seriously. And as a health provider, it is very important for us to tell our clients the truth. Either as a teenager, maybe she had abortion done and she's lucky that she's alive. Please bring her to the family planning clinic. And you as a midwife or as a healthcare provider, you don't have the right to judge her. You don't have right to say she's wayward. Ah, how old are you? No, you can make her to you can that one can be an emotional abuse to her. Our own is to counsel our clients. Our own is to tell them what to do, not to condemn anybody. Nobody is perfect. When you show her love and you talk to her as a mother, you might even help her to stop doing whatever she's doing, that she's getting pregnant without getting married, or she's just sleeping around. There's a way you can do it that God can use you to change her. But your work is for you to make sure that they have safe sex and everything is under control. Thank you for listening. God bless you till I come back again. You can send me a DM if you have questions. You can do so many things. Whatever you want me to talk about, you can send me message. Thank you and see you next time.